been a lot more deaths and that I feel linked to somebody that was there for a lot of them.
Did you have any concerns that there was a rise in the mortality rate?
Yes.
Okay, so tell me about that. What concerns did you have?
I think we'd all just noticed as a team in general, the nursing staff, that this was a rise compared to previous years.
She was a neonatal nurse, a person who prayed for babies every day. But then she was convicted of Britain's most brutal child killer, Lucy Letby, who killed 7 children and nearly killed 7 others. She was sentenced to 15 life terms, a sentence that shocked the justice system. However, the case does not end there. Growing doubts about the medical evidence and the prosecution process are raising serious questions. Is this the biggest miscarriage of justice in British history? Was Letby a cold-blooded killer, or the victim of a terrible mistake? The question is dividing public opinion, and the name Lucy Letby will haunt Britain for many years to come. June 2015. A healthy baby boy at the Countess of Chester Hospital suddenly died just hours after being born. No warning signs, no obvious medical reason. The incident left doctors stunned, and more painfully, it was only the beginning. Lucy Letby, a young nurse, gentle-faced, always showed dedication to the work of caring for newborns. She often appeared with a gentle smile, kept a diary of each case, and did not mind staying overtime. To her colleagues, she was a nice, quiet, unbelievable person. But then, a string of tragedies followed. In less than a year, several more babies died or nearly died, all with one thing in common. They happened during Lucy Letby's shift. At first, doctors couldn't figure out what was going on. They wondered if there was some mistake in the procedure. But as time went on, the frequency of the unusual incidents became frighteningly high. Cases of respiratory failure, hypotension, internal bleeding occurred without any obvious medical risk factors. Some children who had just been successfully resuscitated suddenly died shortly afterwards. Suspicions begin to grow within the hospital. As the statistics are compiled, the chilling truth becomes clear. Most of the deaths and medical failures occur while Lucy Letby is working. An internal investigation is quietly launched, and the shadow of a grisly crime slowly emerges. Lucy Letby was born in 1990 Hereford, Western England. After graduating with a nursing degree from the University of Chester, she was recruited to work in the neonatal unit at the Countess of Chester Hospital in 2011. This is one of the leading hospitals in the area, with a special neonatal intensive care unit, a place to receive premature births, difficult births, or babies with special medical conditions that need close monitoring. Here, Letby quickly made an impression on her colleagues and was considered a long-time stalwart in the neonatal unit. She was rated qualified in internal evaluations and was often described as sweet, dedicated, and fond of children. Although not a standout, Letby was assigned many night shifts and often served as a technical support specialist in intensive care, a position only given to someone with enough trust. No one expected that such a person would be involved in the series of tragedies that lay ahead. The victims were all newborns in the intensive care unit, most of them just hours or weeks old. Many were premature and required ventilators or intravenous feedings, but their initial conditions were usually stable. This makes the series of sudden deaths so unusual and inexplicable, especially when they occurred in the same setting, under the care of the same healthcare worker. Lucy Letby. Before being suspected, Lucy Letby had a quiet and monotonous life. No criminal record, no history of mental illness, no complicated relationships. She lived alone in Chester, worked full-time at the hospital, and had almost no close social relationships. Outside of her duty time, she spent time writing diaries, taking care of her pets, and rarely went out. It was this quietness that made people believe that she was completely harmless. On her social media accounts, Lucy Letby posts gentle images that evoke a sense of peace in the medical environment. Teddy bears placed next to syringes, hands holding newborn babies, or hospital corridors, welcoming the morning Sunday. The content of these posts is not controversial, does not show any extreme or unusual expressions. However, behind that calm exterior were signs of quiet unrest, scattered personal notes, sometimes revealing a troubled, conflicted, and dark inner self. But at that time, no one read those lines, and if they did, it would be difficult to imagine the seriousness of what they contained. Those words were never spoken, never explained. They existed quietly like the person she was, an introverted young nurse, absolutely trusted, but also the center of a series of tragedies that were about to be revealed. Between June 2015 and June 2016, the neonatal intensive care unit at the Countess of Chester Hospital saw a series of unexplained deaths and critical illnesses. 7 babies died. 10 others were narrowly saved. All were initially stable or required only routine medical support. The victims' clinical manifestations raised many questions: sudden cardiac arrest, visceral swelling, and air in the blood vessels. Conditions that are rare in newborns and difficult to explain by natural causes. A remarkable coincidence: Lucy Letby was present at the time of the incident. However, at the beginning, she was still considered a dedicated employee and no one suspected anything. Hospital officials did not consider the possibility of crime at the time. They believed that the cause could be cross-contamination, system failure, or natural medical hazards. An internal audit was conducted, focusing on sanitation procedures, equipment, and sterile practices. But despite the tightening of management procedures, the sudden deaths continued to occur silently, unexpectedly, and increasingly difficult to explain. And now, among the doctors, a simmering suspicion began to form. Something or someone was silently causing the deaths that medical science could not explain. By mid-2016, in the face of a long string of incidents, Lucy Letby was temporarily transferred to administrative work, no longer having direct contact with children. From that point on, the deaths and unusual complications immediately stopped, a clear sign that suspicion was beginning to focus on her. In July 2016, an official undercover investigation was launched. Lucy was secretly monitored by the hospital and Cheshire police. Her work records, shift schedules, interactions with patients, and behavior outside the hospital were all closely monitored. When police searched her home, they discovered several personal diaries, in which were repeated handwritten notes such as, "I am trash, I did it, I do not deserve to live." Although not mentioning anyone by name, these sentences revealed the tormented emotions, like an invisible confession, from a woman who was absolutely trusted in the medical environment. In addition, investigators also discovered that she had purchased and stored many rare drugs that were not licensed for use in hospitals, including compounds that could cause cardiovascular disorders or nerve damage if used in the wrong dose. This was important evidence, showing the ability to be proactive and calculating in behavior. From a nurse who was once absolutely trusted, Lucy Letby has now officially become the focus of a criminal investigation, with details increasingly showing that this is no longer a simple series of medical accidents, but a deliberate, cold, and cruel crime. During the period from mid-2015 to mid-2016, Lucy Letby committed a series of intentional murders, targeting the most vulnerable patients in the neonatal department, babies who had just been born and had not yet had time to get acquainted with the world. Her method of committing crimes was considered sophisticated and difficult to detect. Letby often took advantage of her professional knowledge to attack her victims in a quiet, discreet way. By attacking physiological weaknesses, such as injecting gas directly into the veins or stomach, causing blood vessel blockage, leading to acute heart failure or organ damage. In addition, Letby also used insulin of unknown origin, injected into newborns without any medical indication, causing the victims to drop blood sugar rapidly, leading to convulsions, coma, and death. At the scene, many deaths were recorded with signs of cyanosis, sudden cardiac arrest, and no response to resuscitation. Some nights on duty, Lucy Letby attacked 2 to 3 babies in just a few hours. This put the neonatal department in a state of alarm, but this chaos contributed to concealing the crime in the early stages. What was even more cruel was that after the children died, she remained calm and continued her work as if nothing had happened. In some cases, she even participated in comforting the victims' families, with a gentle face and eyes that seemed to truly share the pain. But behind the image of a devoted nurse, there was a person who actively chose the time, the method, and the victims to kill, cold and calculated. In June 2016, after a series of deaths and unusual complications that lasted more than a year, the leadership of the Countess of Chester Hospital was forced to act. Initial theories such as infection, system failure, or medical complications were no longer convincing enough given the frequency and severity of the incidents. An official internal investigation was launched. The hospital set up a system to review all medical data, employee work records, and detailed statistics on the time of each incident. The results left the leadership team speechless. Mortality in the neonatal unit has spiked sharply in the past 12 months, nearly 3 times higher than in previous years. And when you look at the schedules, a strange coincidence emerges. Every death has occurred during Lucy Letby's shift. Even the non-fatal cardiac arrests, the near-death experiences that are saved, have mostly occurred when she was on the ward. In a medical environment that is strictly controlled, this coincidence is not to be taken lightly. The internal alert was raised to the highest level. Letby was removed from his patient contact position. At the same time, the file was passed to Cheshire Police, marking the transition from a professional examination to a criminal investigation into a suspected medical serial killer, a scenario that had never happened in Britain. In the neonatal intensive care unit, machines are running continuously. All indicators are closely monitored. However, in many deaths, there was no warning of any abnormalities beforehand. Newborns suddenly stopped their hearts, turned purple, and did not recover despite timely intervention, all under completely controlled medical conditions. The bodies of the babies were transferred to the forensic room. Here, the forensic doctor noted an abnormally high level of insulin in the blood, a sign that could not appear naturally, especially in a child who had never been prescribed diabetes treatment. In addition, gas was found in the veins and stomach, an extremely rare phenomenon in neonatal treatment, and usually only occurs with outside intervention. There were no obvious signs of injury, no bruises or injection marks, no mechanical trauma, but the test results did not lie. Under the cold light of the autopsy room, every tissue sample, every milliliter of body fluid pointed to one thing: deliberate, artificial intervention. In a modern medical environment, where every heartbeat is constantly monitored, where every dose of medication is closely recorded, the presence of unknown insulin and gas in the body of a newborn was unusual and could not have been accidental. There was no doubt this was the scene of a man-controlled death. The formal investigation was launched by Cheshire Police in 2017, after the hospital handed over all its internal records and expressed serious concerns about a series of unusual deaths in the neonatal unit. But for a criminal case to be launched, especially in a complex medical environment, the police need more than suspicion. They need concrete, clear evidence that will stand up in court. During the 2-year undercover investigation, investigators collected thousands of documents, from Lucy Letby's detailed work schedules, personal diaries, handwritten notes to nurses' diaries, treatment records, and the dates of each death. Every line, every little gesture was scrutinized for any sign of foul play or intentional involvement. At the same time, the forensic team requested reanalysis of the remaining samples from the victims. Blood, tissue, and biological fluids were tested with more advanced technology, which revealed abnormal insulin levels, body gases, and biochemical markers that would not be present in natural conditions. Each piece of evidence, no matter how small, was strung together into a larger picture. The coincidence of the time of death and the shift, the unusual nature of the deaths, and the repetitive behavior that suggested illegal medical intervention. It took 2 years for the details to fall into place. By then, the diary entries with phrases like, "I did it" and "I'm rubbish" were no longer vague. They became invisible confessions, opening the door to the prosecution of one of the worst medical crimes in British history. In the early morning of the 3rd of July 2018, police raided Lucy Letby's quiet home in Chester. After more than a year of quiet investigation, they decided to make their first arrest, on suspicion of involvement in the deaths of several babies at the Countess of Chester Hospital.
Hello, Lucy, is it?
Yes.
Hello, my name's Chester, please. Okay, step in 2 seconds.
Yes.
Yeah, thank you. Hold on.
Just going to put you in the back seat over here.
Hold on, man.
Yes. Okay, just take a seat in there for me, Lucy.
She was questioned for hours. However, at that time, despite clear signs of suspicion, the police had not yet gathered enough solid evidence to indict. Forensic results, profile analysis, and psychological evaluations were still in the process of being completed. Therefore, Letby was released while the investigation continued. 2 years later, when all the pieces had been put together, when medical evidence, diaries, shift schedules, and independent tests had formed a coherent system, the police decided to take action again. In November 2020, Lucy Letby was rearrested and formally charged with serious crimes: 7 counts of murder and 10 counts of attempted infanticide. This time, she was no longer on bail. The judicial system stepped in, and Lucy Letby's name officially became the focus of one of the most shocking medical cases in British criminal history. During the interrogations after her arrest, Lucy Letby denied all the accusations. She asserted her innocence, saying that she had always loved children and was only trying to do her job well. With a calm and composed attitude, Letby insisted that she was the victim of misunderstanding and pressure from colleagues. However, what the police found painted a different picture. During a search of her phone and computer, they found numerous text messages, notes, and diaries that contradicted Letby's account. Some of the messages she sent to friends around the time of the incident showed her unstable state of mind, accompanied by handwritten, self-accusatory messages such as, "I did it," and "I don't deserve to live." In addition to the psychological evidence, the police invited independent experts in forensic medicine, pediatrics, and toxicology to assess the death records. They unanimously concluded that the deaths were not consistent with normal medical progression, and that signs such as gas in the blood vessels, insulin-induced hypoglycemia, and unexplained internal organ damage were evidence of intentional tampering. These objective assessments strengthened the prosecution case, establishing a direct link between Lucy Letby and the attacks, turning initial suspicions into a chain of legal evidence that would carry weight in court. Lucy Letby's trial ran from 2022 to mid-2023 at Manchester Crown Court, lasting nearly 10 months, one of the most time-consuming and laborious trials in British judicial history involving the health sector. Throughout the trial, Lucy Letby remained silent, did not testify in her own defense, nor did she apologize or express remorse to the victims' families. That silence, in the eyes of the public and the jury, became an expression of coldness and lack of remorse. Prosecutors called her a cold, calculating, vicious person who used her position in a hospital environment to attack the most defenseless of victims' newborns. They stressed that Letby acted deliberately, choosing the timing and methods of her crimes repeatedly and discreetly, all the while maintaining the image of a dedicated nurse to deceive her colleagues. There is no evidence that Lucy Letby suffered from any mental illness, and the psychologists who evaluated her have all determined that she is competent to stand trial. Instead, the investigation records show that she has a tendency to manipulate the emotions of others, hiding her true behavior behind a pleasant and docile appearance. Inside the courtroom, relatives of the victims choked up, while the public watched the proceedings unfold. The crime was revealed not as medical error, but as mass murder in white coats, right in the heart of a modern hospital. On the 21st of August 2023, after nearly a year of trial, Lucy Letby was officially sentenced to 14 life sentences without the possibility of parole or parole. This is the maximum penalty in the British legal system, reserved for crimes considered particularly serious and unforgivable. Lucy Letby became the first nurse in British history to be sentenced to life in prison, marking a dark milestone in the medical profession and the national justice system. In the courtroom, the victims' families could not hold back their tears. The pain of losing their children had not yet subsided, but the defendants' silence and lack of remorse made them even more angry and numb. Many described it as an indescribable pain, when the person who killed their children was someone they had once trusted completely. The case quickly caused a strong reaction in public opinion. Many questions were raised about the responsibility of internal supervision, the delay of hospital leadership, and the loophole that allowed a medical staff to commit a crime for a long time without being detected. After the trial, many experts and politicians called for reform of the internal monitoring system in the medical profession to prevent serious wrongdoings from being covered up. Without change, Letby may not be the last person to use her white coat to cause irreparable tragedy. The Lucy Letby case not only ended with a harsh sentence, but also left a deep scar on the heart of the medical profession and British society. This tragedy is a bitter warning about the blindness of placing all one's trust in the image of white angels, people wearing white coats. But inside they may hide the opposite. It also exposes a heartbreaking truth: silence, cover-ups, or hesitation within the medical profession can lead to the lives of innocent children being quietly taken away. If initial suspicions had been dealt with more aggressively, if doctors' warnings had not been ignored, perhaps many lives could have been saved. What do you think about the case? Why did Lucy Letby do it? Was it personal motive, inner turmoil, or a perfectly disguised twisted instinct? Leave your thoughts in the comments section. And don't forget to like, share, and subscribe to the channel so you don't miss the next shocking videos.